So hello everyone, our next topic is the plaque control. So what is plaque? First of all, all of you should know what is the definition of plaque. It is structured, resilient, yellow grayish substance that adhere to the intraoral hard surfaces, including removable and fixed restoration. So that is the definition of plaque. Now what do you understand by the plaque control? The plaque control means it is the removal of the microbial plaque and prevention of its accumulation on teeth and adjacent gingival tissues. Now what are the various ways of the plaque control? Various methods we use for the plaque control can be either mechanical method or the chemical method. So mechanical method of plaque control involves the physical removal of plaque from the surface, like brushing your teeth with a toothbrush or using a dental floss to clean between your teeth. On other hand, the chemical method of plaque control involves the use of substance like mouthwash, toothpaste that contains the chemical designed to help control the plaque. So these chemicals can kill the bacteria or inhibit their growth, that can reduce the formation of the plaque. So the mechanical methods can be toothbrushing or interdental aids, whereas the chemical methods, they are mouthwash, antibiotics or enzymes. Now let us discuss the mechanical methods first. The first is the toothbrushing. So these are the various historical perspective of toothbrush. Remember it for your entrance exam. Few important points that you have to remember: that the bristle brush toothbrush, it appears in China in 1600, and in 1780 William Eddies of England made the first toothbrush. So remember all these points for exam point of view. Now what are the classification of mechanical plaque control aids? Number 1, you can use chewing sticks, that includes neem sticks, mango leaves or miswak sticks. Second mechanical method is most commonly used is the toothbrush. Depending upon the type of bristle, it can be natural or synthetic. Depending upon the diameter of bristle, it can be soft, medium or hard. Depending upon number of tuft present, it can be space tuft or multi-tufted. Depending upon the function, they can be manual toothbrush, power toothbrush, single headed, double headed or the triple headed. Third are the interdental aids, that includes the dental floss, interdental brushes, toothpicks, wooden tips, yarn, perio aid, and gingival stimulation by use of rubber stimulator, tongue cleaner. Other methods could be gauze strips or oral irrigation devices. So let us discuss them one by one. The first are the toothbrushing. The objective of toothbrushing is to clean the teeth and interdental space of the food remnants, debris and stains, prevent plaque formation, remove the plaque, stimulate and massage the gingival tissue. Now what are the parts of toothbrush? The toothbrush has head. This one is the head part that holds the bristles. These are the bristles. It is the top portion that you use to clean your teeth. Second is the handle part. The handle, it is the long part of the toothbrush that you hold in your hand while brushing. So it is usually made to be comfortable to the grip. Third are the tuft. A tuft is a small cluster of bristle on the head of toothbrush. Other is the shank portion. The shank is the neck part that connects the head to the handle. So all these are the parts of the toothbrush. The handle can be straight handle or quadrangle handle. It can be either flexible handle. The flexible handle reduce the gum injury by excessive brushing force. Now the toothbrush profile, it can be either concave shaped, convex shaped or multi-level profile. The concave shape with the shorter bristle in the middle of head that is mainly used to clean the facial tooth surface, whereas the convex shape with the longer bristle in the middle of head appears to be useful for cleaning the lingual surfaces. And the multi-level profiles, they are used when the interproximal efficacy was evaluated. Now these are the parts of toothbrush: shank, tuft, bristles, already discussed. The natural bristle, it is made from hair of hog or wild boar. So hair of hog or wild boar refer to the bristle-like hair that grows on wild boar body. So wild boar, they are type of pigs that are found in various parts of world, and they are known for tough and wiry hair. So this hair is used for making brushes, etc. The artificial filament, it is made from the nylon. Remember, the bristle hardness, it is strictly proportional to square of diameter and inversely proportional to square of the bristle length. So the diameter of bristle, remember this for your MCQ point of view. They can be either ultra soft brush, medium brush, or the hard brush. The diameter, remember the diameter 0.075, 0.2 mm, 0.3 mm and 0.4 mm. Remember this, the diameter for your entrance exam point of view. Now these are the design of the brushes. They can be wavy V shape, bristles, block pattern that are of same length, or crisscross pattern. The bristles designs can be of crisscross that can lift up the plaque very easily. Now this one is important for your entrance exam point of view. According to the ADA, the length of the brushing surface should be 1 to 1.25 long, and the width of brushing surface should be 5 by 16 to 3 by 8 inches wide. Now the rows of bristle should be 2 to 4. So what do you mean by rows of bristle? Suppose this one is a brush, and it refers the rows of bristle refer to the lines or group of bristles that are that appear straight on the brush head. So a toothbrush, it has multiple rows of bristles, usually placed side by side. The tuft per rows, that means that should be 5 to 12, and rows of bristle is 2 to 4. The tuft per rows indicate how many clusters or bunches of bristle there are in each individual row on the brush head. So it's the number of separate group of the bristles you find in the single row. So that amount is 5 to 12. The third is the bristle per tuft. The bristle per tuft refers to the number of individual bristles that make up each of the clusters on the brush head. So that will indicate the density of the bristle within each tuft. So brushes with higher bristle count per tuft might be more effective for cleaning. Now, what should be the frequency and duration of the toothbrushing? The best estimate of actual toothbrushing time seems to be between 30 to 60 seconds, and optimum time is 2 minutes for the plaque removal. The average lifetime of a toothbrush is estimated to be around 2 to 3 months. So you have to change the your toothbrush after every 2 to 3 months, as the first before the first sign of the filaments become worn. Just change your toothbrush. Brushing force with the powered toothbrush is to be lower than that of manual toothbrush, and the force, that is 1 Newton difference between the manual and power toothbrush. So let us discuss the brushing technique depending upon the motion of the brush during brushing. That is very important for your exam point of view. The first is the horizontal technique, that is also known as scrub technique. The horizontal technique is scrub technique. Second, vibratory method, that includes the Bass method or the circular method or Stillman brushing technique or Charter brushing technique. So the vibratory method utilize Bass technique, Stillman brushing technique, Charter brushing technique. The vertical method involves the modified Bass brushing method, modified Stillman brushing method, Leonard brushing technique, Smith Bell brushing technique. The circular method includes the Fons technique. So remember all these for your entrance exam point of view. So these many times questions are asked based upon these techniques. The first is the horizontal tooth brushing. Which one is the technique is the most common used brushing technique? Yes, it is the horizontal brushing technique. So it is the most frequently used by individual who never had instruction in the oral hygiene technique. So here the head of brush, it is positioned perpendicular to tooth surface, and then horizontal back and froth motion is applied. So remember, this technique is known to cause excessive tooth brushing trauma. So which technique can cause maximum tooth brushing abrasion? It is horizontal tooth brushing. So remember this point for your exam point of view. Generally they ask. Second is the vertical brushing. It is also known as Leonard technique. The vertical brushing technique is the Leonard technique. So the bristles of toothbrush, they are placed at 90-degree angle to the facial surface of the teeth. So with the teeth edge to edge, place the filament against the teeth at right angle to the long axis of teeth. So vertical brushing technique, showing the motion upward and downward. So this technique is most convenient and effective for small children with the deciduous teeth. And disadvantages includes the interdental spaces of the permanent teeth of adult, they are not properly cleaned. The next is the circular brushing technique, which one is known as Fons technique. So which technique is indicated in young children? It's the Fons technique. Which technique is given in emotionally handicapped individual? It is the Fons technique. The patient who lack dexterity, it is against the phone's technique. The child is asked to stretch his arms such that they are parallel to the floor. The child is then asked to make big circle using the whole arm to draw a circle in the air. The circles are reduced in diameter until very small circles they are made in the front of mouth. So this technique is easy to learn, shorter time is required. The disadvantage could be there could be possible trauma to the gingiva. The interdental areas, they are not cleaned properly. The next is the BAF technique, also known as circular technique. So which technique is which technique is also known as circular technique? It is the BAF brushing. Which technique is most widely accepted technique? It's the BAF brushing technique. Which is the most effective technique for removal of the dental plaque? It is the BAF technique. So it is used for the patient with open interproximal areas, cervical areas beneath the height of contour of the enamel and exposed root surfaces. So here the bristles they are placed at 45 degree to the long axis of tooth. They are generally forced into the gingival sulcus and interproximal areas, and they are moved short, back and forth motion. The strokes with vibratory actions for around 20 times, 3 times a day. On the lingual aspect, the brush is inserted vertically and the heel of brush it is pressed into the gingival sulcus. The occlusal surfaces are cleaned by pressing the bristles firmly against the pit and fissure and activating the bristles. It is easy to learn, provide good gingival stimulation and cleans the gingival sulcus. It removes the plaque from interdental areas and cervical areas. So overzealous brushing may convert the very short strokes into scrub brush technique, so that can cause injury to the gingival margin. The other is the vibratory technique. The vibratory technique is the Stillman technique. It is as similar as BAF technique, except the bristles that are placed over the cervical portion of the tooth and partly on the adjacent gingiva. So the brush it is placed at the same manner, that is 45 degree to the long axis of tooth. The brush is activated, short back forth strokes, and it is moved in a coronal direction along the attached gingiva. So it is indicated for spongy gingival tissue, for cleansing area with progressive gingival recession and root exposure. The next is the charter technique or vibratory technique. So which technique is used for individual having open interdental spaces with missing papilla and exposed root surface? It is the charter technique. So which technique is used for patient wearing fixed partial denture or orthodontic appliances? It is the charter technique. So this question was asked in your one of the entrance exam, that a patient wearing partial denture or orthodontic appliance, identify the technique, toothbrushing technique. The preferred toothbrushing technique here is charter method. The patient, those who have periodontal surgery, they are charter technique is indicated in them. Patient with moderate interproximal gingival recession, again charter technique is indicated in them. Similarly, the brush they are paved at 45 degree to the long axis of tooth. The bristles are moved into the interproximal surfaces with slight rotatory and vibratory movement. So this technique has an advantage that plaque is removed gently without much pressure. The other is a roll technique. It is also known as rolling stroke method or ADA method or the sweep method. So this type of method is indicated in children's and adult patient with limited dexterity. So the bristles, they are placed at 45-degree angle apically on the attached gingiva and lightly rolled against the gingiva in a coronal direction to blanch the tissue momentarily. So this technique requires some flexibility around the wrist. So the advantages are provides gingival stimulation. The disadvantages include poor plaque removal from the gingival third of posterior teeth because of the contour of the teeth, poor plaque removal from the sulcus area, and the brushing too high during initial placement can lacerate the alveolar mucosa. So this was the roll technique. Other is the modified pass or Stillman technique. They were designed to concentrate on the cervical portion of the teeth and adjacent gingival tissue. So each of these techniques can be modified to add a roll technique. So the brush is positioned as similar as the pass technique. After activation of brush, head is head in a back and forth direction. The head of brush, it is rolled over gingiva and tooth in a occlusal direction, making it possible for the filament to reach the intergingivally. Other is the physiological method or Smith. This method was given by Smith and advocated later by the Bell. So it is based upon principle that toothbrush should follow the physiological pathway that is followed by food and when it travels over the tissues during the mastication. So the advantage is it is a natural self-cleansing mechanism. Supragingival cleaning is good, and the interdental space and the sulcus area, they are not cleaned properly. So this was all about the toothbrushing and technique. So this table is very important for your entrance exam point of view. The Phones technique, the most recommended brushing technique in children is the Phones technique. Most common brushing technique after periodontal surgeries is Charter technique. Most recommended brushing technique for cleaning fixed orthodontic appliance, it is modified Charter technique. Most recommended brushing technique in case of gingival recession, it is modified Stillman technique. The most recommended brushing technique for patient with periodontal disease is the sulcular technique. The most recommended brushing technique for any individual with or without periodontal disease is pass technique. Most common recommended brushing technique is pass or sulcular technique. Most recommended brushing technique for sulcus cleaning is the modified pass technique. Brushing which causes tooth abrasion, it is the scrub technique. So remember all these for your entrance point of view. Many a times, many questions has been asked in entrance exam related to this. So that is very important for your examination point of view. Other is the super brush. What is super brush? It was designed by Dr. Herman. It is a triple headed manual brush. So there are one head, two head, and here is the third head. So three brush heads, they are combined together. So when placed on chewing surface, all the three surfaces of tooth are cleaned simultaneously. So that will shorten the brushing time. So it is cheaper alternative for use in the case with the disabled individual. Other is the powered toothbrush. They are the electrically powered toothbrush that are designed to mimic back and forth brushing technique. So power brush can give various types of motion like reciprocating, arcuate, orbital, vibratory, elliptical, or doing motion. The speed, the number of strokes per minute, that varies from 1000 cycles for a replaceable battery to about 3600 oscillations per minute. Remember these values for your entrance point of view. What are the ideal characteristics of power toothbrush? It has an active brush tip to facilitate the plaque control and orthodontic head for brushing around and beneath the component of fixed orthodontic appliance. A rotating spiral filament for interproximal cleaning. So it is indicated in children's, handicapped patient, hospitalized patient, patient with ortho appliances, patient those who lack fine motor skills are also recommended with the powered toothbrush. Other is the sonic powered toothbrush. So this type of toothbrush produce high frequency vibrations that can produce phenomenon of cavitation and acoustic microstreaming. So that will help to remove the stain as well as disruption of the bacterial cell wall. That is, they have a bactericidal effect. Other are the electrical active ionic brush. So based upon positive and negative charge. So that based upon the principle of changing surface charge of tooth to repel plaque from the inaccessible area of the teeth. So that is the main principle of the electrically active toothbrushes. Other are the ultrasonic brushes. They have a piezoelectric ultrasonic emitter that is embedded in the brush head. So that is driven by power supply that operates at 1.6 megahertz. So Amident, it is the first ultrasonic brush. Other are the UV sterilized toothbrush. So those patients who have habit of keeping everything clear and germ free are recommended with ultraviolet sterilized toothbrush system. So they sterilize the toothbrush when it is placed, and it is the most effective household method to sanitize the toothbrush after the contamination. Other are the laser toothbrush, where laser toothbrush are improved version of the modern toothbrush that emit red light in visible spectrum that are powered with the battery. So they help to reduce the dentinal hypersensitivity. So that is the main advantage of these toothbrushes. Other are the chewable toothbrush. So it can be used when there is no water is available. It should not be swallowed and should be disposed of after use of xylitol, flavoring aqua and polydextrose. So they are used as similar as way one would use a chewing gum. Tooth towelettes, they are the most method of plaque removal when the toothbrush is not available. These are the tooth towelettes. So the finger brushes, they are mounted on the index finger of the brushing hand, and they are used to clean the teeth. Other are the foam brushes. They resemble a disposable soft sponge soaked in chlorhexidine on a stick. So they have been dispensed to the hospital patient for intraoral cleaning. So that is why it's their main use. They are used in hospitalized patient. Other are the beam toothbrush. They have a sensor embedded to record and map the brushing behavior, so that data can be saved and analyzed later on. So brush beam, it can collect up to 3 weeks brushing data. So they are helpful in oral health information. Other are the caries detecting toothbrush, that is C-Smart toothbrush, that will able to tell the users whether they have caries developing on teeth or not. So they use a laser technology that collect the reflected light from the caries that is sent to a microcomputer chip in the toothbrush handle.